myself Sarvesh. I am from Pune. I am an IT engineer working in Capgemini. I had a difficulty in walking and I was facing very much pain in my left hips. So I consulted few doctors, then did my MRI. So I was detected with AVN, avascular necrosis. So for that, I got a reference from Dr. Anuradha Goel for this hospital. So here in Upasani Multispeciality Hospital in Mulund, I have treated by Dr. Tejas Upasani and I have gone through core decompression with bone graft surgery.
So Sarvesh, who is a 26-year-old boy, he came to us with difficulty in walking and he had a lot of pain in his hip joints and he suffered from a condition called as avascular necrosis of both femoral head. Now this condition earlier used to be seen in little older patients, but post-COVID we are seeing it in very young people. The problem is the blood supply to the femoral heads, that's the bones which are there in our hip joint, reduces, and that is why they get pain and then the bone starts weakening and then arthritis can set in. Now for such young patients, the other option is to do a hip replacement, but we tend not to do hip replacement in such young patients, but if it's inevitable we have to do it. But there is another option. What we do is a stem cell therapy where we take out bone marrow of the patient. It is sent to a lab where they make osteogenic cells, and the cells which will form new bone. So that takes around a month's time for them to make a culture and grow that. And after the culture is ready, we get a call from the lab that it's ready. Then we do a surgery called as core decompression, where we make a big hole into the bone and remove that dead bone. And there we inject this new osteogenic bones, and that can form new bone. So this therapy, it's like a stem cell therapy, and it's shown very good results. And that's why it's like a great thing for young patients. So at USSH we are offering such latest state of the art surgeries as well as technologies. As for knee we have robotic. Also we will soon be getting robotics maybe for the hip also. And this is like a bone or a joint conserving surgery where we are not replacing the joint but trying to save the patient's joint only.
I got admitted in this hospital on 27th of Feb and today 4th of March is my discharge date. And I would like to say a few things about this hospital, that it is very great, the services are very fine, the food is also good, the nurses are helpful, all the ward boys are also very good. So I would overall give 4.5 stars out of 5.